Hello everybody, my name is John Blanchard. I'm a family physician with Salta Direct Primary Care here in Michigan, and I'm here again in the COVID camper with the next update video on what's going on with COVID in Michigan. Today is April 13th, and this is the 21st day that I've been living here in the camper. We have a question from Julie on Facebook asking about whether there's any treatments that are currently used for cystic fibrosis that can be used to treat the COVID virus. People with cystic fibrosis are at higher risk of serious illness from COVID because the condition is a genetic condition that can affect the lining of the lungs, and COVID also attacks that. There isn't any good research out at this point that any treatments for cystic fibrosis can help in the treatment of COVID. So we're keeping an eye on any new research that comes out. Greg asked about whether there's any more testing capability in the state of Michigan. And if you go to the michigan.gov/coronavirus website, there was just a press release that testing in Michigan has been expanded. There's additional testing available in Detroit and Flint. We're going to put all of the locations and the phone numbers to call for testing on our Facebook page, so you can find those there. There is still criteria that you have to meet in order to get tested at these centers, but they want you to call ahead, and the phone number will be on our Facebook page at Salta of Clarkston, facebook.com/Salta of Clarkston, and facebook.com/Salta of Troy. But you call ahead, and they'll tell you whether you can get the testing or not. I think we're going to see more testing coming in the coming weeks, which is going to be really important for us to try to contain the spread of the virus once the quarantine is released. We had another question from Jim about the different treatments that are available for COVID and the things that's being heard on the news. Things like convalescent plasma transfusion. This is where we take plasma from someone who has antibodies to COVID, and we transfuse it into a patient who's really sick with COVID. There's some ongoing studies looking at that as a treatment modality. You're going to hear things like that are called antiviral medications. COVID's a virus, and there's different types of antiviral medications that are being tested in the treatment of COVID. You're going to hear something called immune modulators, which are medications that we use that can downregulate the immune response, especially late in the illness when you can have what's called a cytokine storm, which is your immune system going into overdrive, and we think that that's driving a lot of the serious illness that's occurring in people and problems with respiratory failure. There are medications that can be used to target certain aspects of that immune response and downregulate it. Again, those studies are ongoing. And then you've probably heard of hydroxychloroquine, which is a medication that was previously used for malaria prophylaxis and treatment of malaria. Again, there's studies going on right now with that. It's not recommended to use for the general public right now until studies come out to show that it's safe and effective. Moving on to one positive thing that I hope comes out of this experience is, again, learning about mindfulness. People are at home right now dealing with a stressful situation. This is a great time for you to learn about mindfulness. And one of the things that we're addressing in these videos is understanding that we can fall into thought distortions. And it's important to identify when you're in a thought distortion and change it to a positive way of thinking. So we've covered black and white thinking, we covered personalization, we covered should statements, and today we're going to cover catastrophizing. So somebody might be catastrophizing when they take an unfortunate event that's small and make it into a big problem. So someone might not do well on a test and think they're going to fail the course, or they might not even have taken the test. Already they're thinking that they're going to fail the course. A couple might have a small argument, and a person might think that that's going to lead to a divorce. That's all called catastrophizing. And when we do that, it drives a lot of stress response. So we need to catch ourselves and make sure that we're not falling into that thought distortion. One of the things that I like about being a direct primary care physician at Salta Direct Primary Care is that we don't work for the insurance companies. We work for our patients, and we don't bill insurance. So people pay a monthly membership fee that's usually around $90 a month, and for that they get all the primary care they can consume throughout the year. And this always made sense to me because I never understood why we have insurance for primary care. Primary insurance is for something that is catastrophic, that happens infrequently, something that is financially catastrophic but happens infrequently. Primary care is something that happens frequently and it's very inexpensive. So it's really not something that should be subjected to insurance. It should be paid for just directly from the patient. That's why we call it direct primary care. And if you think about it, it's kind of like if I were try to sell you insurance for your car that covered windshield wipers and brakes and tune-ups and oil changes, you'd think I was crazy. You know, you want to go out and you want to pay for those in the marketplace by finding the best value for those services. You wouldn't pay insurance for that. But somehow we think that primary care should be subjected to health insurance. So it's never made much sense to me. It makes much more sense for people to pay directly for primary care because it's an event that happens frequently that's inexpensive. So if you want to learn more about direct primary care and if direct primary care can work for you, feel free to visit us at facebook.com/Salt of Clarkston or facebook.com/Salt of Troy. Or you can call Kyle at 248-922-3076 and he'd be happy to answer all of your questions. Thanks again for watching, and we'll see you again later this week. We'll do another update video. Thank you.